The pills in nearly every medicine cabinet in America, ibuprofen and naproxen, are so ordinary we assume they're harmless. But among arthritis patients alone, the complications from long-term use are tied to an estimated 16,500 deaths a year in the United States. That is not a scare statistic. It comes from decades of published surveillance data. Now here is what almost no American doctor will bring up. There is a root from the Kalahari Desert that physicians across Europe have prescribed for back and joint pain for decades. The clinical trials on it are real. The catch, and there is a catch, is that no company can patent a plant. This is devil's claw. Here is exactly what the science says it can do, what it cannot do, and who should never take it. More than 30 million Americans take non-steroidal anti-inflammatory drugs every day to manage everything from minor headaches to chronic arthritis. For the vast majority, these over-the-counter and prescription medications provide reliable relief that allows them to work, move, and live without constant discomfort. These pain relievers are highly effective, and they remain important tools in modern medicine. But the sheer scale of daily use has obscured a severe health burden. Every year, clinical data links roughly 100,000 hospitalizations in the United States to gastrointestinal complications from these drugs. This baseline of risk represents a quiet danger, particularly for older adults and patients on high doses. Many of these complications occur without any warning symptoms, meaning the internal damage often goes completely unnoticed until an acute emergency arises. Treating these everyday medicines as entirely harmless or safe enough to ignore is a profound overstatement. While these conventional treatments remain necessary for millions, their real long-term risks explain why patients and researchers alike are actively looking for other evidence-based tools to manage chronic joint pain. Harpagophytum procumbens, commonly known as devil's claw, is native only to the semi-arid Kalahari Desert and surrounding steppes of Namibia, Botswana, and South Africa. For centuries, the San and other southern African peoples harvested the deep-growing tubers to treat pain, fevers, and digestive issues, passing down sustainable harvesting practices through generations. The common name refers to the plant's sharp, hook-covered seed pods, which cling to animal fur to disperse seeds. Despite what some commercial marketing in the United States suggests, devil's claw is not a Cherokee or North American remedy. This myth conflates the African plant with an unrelated desert species native to the American Southwest, which was historically used for weaving baskets. Representatives of the Cherokee Nation have clarified that this plant is not part of their ethnobotanical tradition. The plant's journey to the West began in the early 20th century when G.H. Menert, a German soldier, observed local healers in southern Africa and sent samples back to Europe. By 1953, the root was formally imported, establishing a pathway into European phytotherapy that continues today. To evaluate these traditional claims, modern researchers have isolated the plant's active compounds, known as iridoid glycosides, with harpagoside being the most prominent. In laboratory studies, these compounds suggest an ability to dampen inflammatory signaling pathways, including the suppression of specific enzymes linked to joint degradation. The clinical evidence, however, presents a complex picture. In April 2016, the Cochrane database of systematic reviews evaluated trials on herbal medicines for low back pain. They found that devil's claw reduced pain more than a placebo, but they also noted that the trials varied in quality, often involving small sample sizes and inconsistent reporting. Earlier systematic reviews from 2004 and 2005 also reported moderate evidence of benefit for osteoarthritis and chronic back pain, suggesting a daily dose of 50 to 100 milligrams of harpagoside could offer relief. This range represents what researchers used in these trials, not medical advice for individual patients. In head-to-head clinical trials, the extract performed competitively against conventional pharmaceutical drugs, such as diacerin, over 12-week study periods with similar functional improvements. However, because these comparative studies were relatively short, they do not answer questions about how well the herbal extract performs over several years. The European Medicines Agency monograph also recognizes its use for minor articular pain, but limits recommended self-medication to 4 weeks. Ultimately, these findings come with an important boundary. While the data show real pain reduction, the honest ceiling for Devil's Claw is that it is promising, not proven. Many of the existing trials were small or methodologically weak, and long-term safety data beyond a few months remained thin. The assertion that herbal remedies offer relief with zero side effects is a marketing claim, not a medical fact. In pharmacology, natural and gentle are not synonyms. The reality is straightforward. A plant strong enough to help is strong enough to interact. For specific groups of people, Devil's Claw poses distinct risks. Because the active compounds stimulate the secretion of stomach acid, anyone with active gastric or duodenal ulcers, chronic heartburn, or gastritis should avoid it entirely to prevent worsening irritation. The danger extends to those taking cardiovascular medications. Patients on blood thinners like warfarin face a serious risk, as Devil's Claw can potentiate these drugs and increase bleeding times. Clinical cases have documented subcutaneous purpura, bleeding under the skin, in patients combining the two. Those with unstable heart conditions, high blood pressure, or gallstones also belong in the strict avoidance category. Those managing diabetes must proceed with caution, as the herb can lower blood sugar and interfere with blood glucose medications. Because of documented oxytocic activity that can trigger uterine contractions, pregnant and breastfeeding women should avoid it entirely. No one should discontinue prescribed medical treatments to experiment with herbal alternatives. Anyone considering Devil's Claw must consult a physician or pharmacist first, ensuring that a pursuit of joint relief does not inadvertently compromise other aspects of their systemic health. White willow bark has been used for millennia across ancient Greek, Chinese, and Native American traditions to alleviate discomfort. It contains salicin, the active compound that inspired modern aspirin. Because it behaves like aspirin, it carries matching risks, including stomach irritation and internal bleeding. It should never be given to children with viral illnesses due to the risk of Reyes syndrome, proving that natural and gentle are not synonyms. Turmeric, a staple of South Asian medicine, relies on curcumin to target inflammatory pathways. In clinical trials, standardized turmeric extracts performed comparably to conventional nonsteroidal anti-inflammatory drugs for knee osteoarthritis pain. The plant's primary limitation is poor oral absorption, which is why formulas often add piperine, a black pepper extract, to boost uptake. Still, like any active botanical, turmeric carries its own cautions, including a mild blood-thinning potential. In clinical trials, researchers administered a daily range of 50 to 100 milligrams of harpagophytum, or roughly 1 to 3 grams of standardized extract. These figures represent the parameters used in scientific research, not personalized medical advice. Understanding this difference is key. Devil's Claw does not function like a fast-acting painkiller. Any therapeutic effect builds slowly over several weeks, rather than offering relief within minutes. Individuals should never discontinue prescribed medications to experiment with this route. The safe next step is to raise the question with a doctor or pharmacist before changing any existing treatment. This plant is best approached as a potential tool to discuss rather than a replacement to gamble on. Today, finding safe pain relief remains a delicate balance. Devil's Claw offers a promising alternative, but natural is never a synonym for risk-free. True healing begins with evidence, not marketing. Consult your doctor before changing treatments and share your thoughts in the comments below.